Lupus is a chronic autoimmune disease that can damage any part of the body. An autoimmune disease occurs when the body, particularly the immune system, attacks itself. Both men and women are affected by lupus, but women are more likely to develop the disease. There are 4 different types of lupus. The first type is called systemic lupus erythematosus, or SLE. This type of lupus is the most common and it can affect the skin, joints, kidneys, brain, and the blood vessels. SLE can range from mild to life-threatening depending on when one is diagnosed. Early diagnosis can help a doctor provide the patient with effective treatments to have a better quality of life. Late diagnosis will lead to less effective treatments, more complications, and an increased risk of death. Treatments for SLE consists of primarily immunosuppressive drugs that inhibit activity in the immune system. The next type of lupus is called cutaneous lupus erythematosus, which affects the skin. There are 2 types in this category. The first type is called discoid lupus erythematosus, and the second type is called subacute cutaneous lupus erythematosus. Discoid lupus is a raised rash that will become scaly and may change its color to a dark brown. The rashes will usually appear on the face and the scalp, but they can also occur in other areas. Discoid lupus can also cause sores in the mouth or nose. Subacute cutaneous lupus erythematosus causes skin lesions on parts of the body that are most commonly exposed to the sun. The third type of lupus is drug-induced lupus that can be caused by taking certain medications. This type of lupus can be cured if one stops taking the medications that are causing it. The medicines that usually cause drug-induced lupus are seizure, high blood pressure, or rheumatoid arthritis medications. Not everyone who takes these medications will develop lupus. The last type of lupus is called neonatal lupus. This type of lupus is usually rare, but it occurs in infants because of certain antibodies from the mother. The antibodies are from mothers who have lupus, but not every pregnant woman with lupus will pass it to their baby. It is also possible for a baby to develop neonatal lupus even if the mother does not have lupus. If this is the case, the mother may develop lupus later in life. If the baby is born with lupus, they may be born with a skin rash, liver problems, or low blood cell counts. There are many different symptoms that may occur when someone has lupus. It is hard to determine if one has lupus because many of the symptoms are symptoms to other diseases like rheumatoid arthritis, blood disorders, fibromyalgia, diabetes, and thyroid problems. This may occur because lupus affects many different organs and the symptoms can come and go. Common symptoms that can occur in men and women include extreme fatigue, headaches, painful or swollen joints, fever, anemia, swelling in the feet, legs, hands, or around the eyes, pain in the chest during deep breathing, butterfly-shaped rash across the cheeks and nose, sun or light sensitivity, hair loss, blood clotting, fingers turning white or blue when cold, and mouth or nose ulcers. This is a large range of symptoms, so lupus is called the great imitator because it imitates other diseases. Like any other disease, there could be many factors that may cause lupus. These factors include hormones, environment, genetics, and medications. Since 9 of every 10 occurrences of lupus are in females, researchers have begun to look at the relationship between lupus and estrogen since estrogen is much greater in females. Women are more likely to have lupus symptoms before their menstrual cycle or during their pregnancy when estrogen is high. In the US, about 1.5 million people have lupus, and 9 out of the 10 diagnoses are women ages 15 to 44. Lupus is most common to women during the years that they are able to have children, which explains the link in estrogen with lupus. Women with lupus also increase their chance of developing diseases like heart disease, osteoporosis, and kidney disease. Genetics play a role in certain ethnic groups having an increased chance of developing lupus. These ethnic groups include people of African, Asian, Hispanic, Native American, Native Hawaiian, or Pacific Island descent. African American women are 3 times more likely to develop lupus than white women. African American and Hispanic women may also get lupus at a younger age with more severe symptoms, such as kidney issues.
I always say that even on my good days, most people would have called in sick if they felt the way I feel on good days.
When Caroline Gort was diagnosed with lupus more than a decade ago at the age of 30, she remembers struggling with the word incurable.
Our brains are hardwired to assume that if you get sick, you get better.
No two cases of lupus are the same. Any tissue or organ in the body can be affected: skin, heart, brain, kidneys. Caroline says for her, life is a daily battle with extreme exhaustion and severe joint pain, all because her misguided inner defense system is attacking her own cells.
So the job of our immune system is to fight bugs or cancers. And in lupus, the immune system cannot distinguish the self tissues from infections or bugs or other things.
Mayo Clinic rheumatologist Bai Chowdhury says the cause is unknown, but seems to involve a combination of genetics and the environment. And women are 9 times more likely to develop lupus than men.
Hormones, female hormones, can also increase the risk. In fact, a lot of people recall having their lupus start after pregnancy or conditions that have increased hormonal status.
The wide variety of symptoms often leaves patients without an accurate diagnosis for years. Caroline says her reddened cheeks and sensitivity to sunlight are common among her friends with lupus. So too are skin rashes, achy joints, anemia or low white blood cell counts, fevers and headaches. Dr. Chowdhury urges anyone with these persistent symptoms to see a rheumatologist because lupus may lead to other conditions like heart disease.
In fact, women in the 30 to 45 age group are at 50 times increased risk of having a heart attack compared to women of the similar age group.
Caroline's hope lies in research, knowing that the next breakthrough might be the one to free her from the anti-inflammatory steroids most patients depend on.
It's wonderful that the medication allows you to function and keeps you alive, but mood swings and insomnia and weight gain and severe hunger are significant side effects that are hard to live with.
For the Mayo Clinic News Network, I'm Dennis Doda.
There are many different holistic treatments when it comes to lupus. The first treatment is turmeric. Curcumin is an active ingredient in turmeric, and it can help reduce the inflammation in lupus. Ginger can also help by reducing swelling in joints. Apple cider vinegar may also help because health practitioners believe that lupus patients suffer from a deficiency of hydrochloric acid, and one way of adding it to your body is by using apple cider vinegar. It will increase hydrochloric acid production in the body and help enhance nutrient absorption. Fatigue is a common symptom of lupus, so it is recommended to take Epsom salt baths. Epsom salt improves magnesium absorption in the body and aids the removal of toxins. It also helps in reducing inflammation and joint pain. Lupus is a serious condition that we don't know much about. We are still learning more about the disease and different ways to treat it. It is a complex disease that needs more funding to research and learn more ways to prevent this disease from affecting the future generation of women. Luckily, this disease is not lethal and 80 to 90% of people can live a normal lifespan.